Hi, my name is Allison Richardson, and I will be talking about my a clinical situation which I encountered during my first clinical rounds. So I was on a medical surge unit, and there was a patient with COVID-19. This patient was an 82-year-old Amish male with pre-existing health issues. He has AFib and he has a pacemaker. He came in to the emergency room with symptoms of COVID. He was having shortness of breath and a fever. I was told in a report that his wife initially was with him, but once he was admitted she had to leave due to him being admitted. There are no visitors allowed with patients who've been tested for COVID or who have COVID. So he was tested in the ER. When I first met the patient, you could tell he was very upset at the situation at hand. Unfortunately, my preceptor and I had delivered the news that he indeed had COVID-19. My role as a nursing student was giving vitals, or taking vitals and giving medications. I also would give him heparin shots to prevent DVTs, deep vein thrombosis, while he was admitted due to him being mostly bedbound for the first couple days. The situation he was in, I tend to believe, was attributed a lot from having pre-existing health issues and also his age. The information I needed to continue to monitor with his COVID-19 was his progression on oxygen and his lung sounds. He did not come in with oxygen, nor did he wear it at all. He had to be put on oxygen due to his levels dropping to the low 80s. And at night, he would end up getting to have 4 liters of oxygen just to be stable at 90s. So, but during the day, he would lower to 2 liters. My preceptor was really great in helping me think and prioritize as a nurse. We took vitals and did assessments 3 times during our assigned shift. Since our gentleman had COVID-19, we wanted to limit our exposure to him and vice versa. For example, if he had medication due at 8 a.m. and one at 9, we would decide like what time we were going to and just bring it in on the same time to limit that exposure. The family was definitely upset not being able to come up and see him. I could tell he was highly respected in his community. He was always having phone calls throughout the day, and it would start around 8:30 a.m. to about 9 p.m. at night. He was constantly answering his phone. And he insisted of always answering, even though he looked exhausted. So right now I currently work in the hospital setting. So while I never experienced taking care of a COVID-19 patient before, I sympathized with him. Every time I went in there, I would talk with him and just ask him if there was anything that I could do for him. He was very appreciative, and I told him, you know, if he needed anything, whatever it was, just let me know, and he enjoyed that. I was there just to even just talk with him. So he did end up getting convalescent plasma and some antibiotics during his stay, and he did not understand. Even though he got that stuff, he still felt fine. He came in with no pain, and this is where I educated him, telling him that even though you may feel fine, your body is still fighting this disease, and it's not a quick fix. And you're still contagious, so you don't want to put yourself more at risk for going home too soon and having to come back and staying even longer or whatnot, and also not to want to get the family any exposure to this or have one of them get it. So our goal